Your 60s are an exciting time in your life, but it's also the time when many people start to slow down and retire from their jobs. This is a time when you can enjoy all the things that you could undo before because of work. And if you're lucky enough to have reached this age, then congratulations, because not everyone gets to live that long. So make the most of it. However, when you reach the age of 60 or over, there are certain things that you need to keep in mind. One of them being that after the age of 60, you should be more proactive about your health than ever before. However, these tests aren't perfect, and they can sometimes cause harm. For example, mammograms can be painful, and colonoscopies can cause bleeding. In addition, cancer screening tests can give you a false sense of security. It's most commonly associated with Alzheimer's disease, but there are many other causes of dementia. Advanced care planning is an important part of ensuring that your wishes are respected. If you become unable to make decisions for yourself, we hope you found this video helpful. Please remember to share and like for more health tips and advice. Stay healthy and happy. This is especially true as we get older and our health begins to decline. Advanced care planning can help you and your loved ones avoid making difficult decisions about your medical care. If you become incapacitated, it also allows you to ensure that your wishes are respected, even if your loved ones disagree with them. Getting your affairs in order now can save your loved ones from a lot of stress and heartache down the road. Here are some things you can do to start planning for the future. Make a living will. A living will is a document that allows you to state your wishes regarding medical treatment. For example, you may not want to be kept alive on life support if you have a terminal illness, or you may want to be given the chance to try experimental treatments. Make sure your living will is legally binding in your state and that your loved ones know where to find it. Appoint a power of attorney for healthcare. A power of attorney for healthcare is a document that allows you to designate someone else to make medical decisions on your behalf. If you become incapacitated, this person should be someone you trust and who knows your wishes regarding medical treatment. Put your affairs in order. This is another essential aspect of advanced care planning. You should make sure that your financial affairs are in order, so that your loved ones won't have to worry about them if you pass away. This includes having a will, setting up a trust, and arranging for the care of any dependents. By taking these steps, you can help make sure that your loved ones are taken care of if anything happens to you. Advanced care planning isn't something most people want to think about, but it's an important way to protect yourself and your loved ones. In fact, dementia is the most common cause of disability in people over the age of 65. There is no cure for dementia, but there are things you can do to reduce your risk. According to the Alzheimer's Association, these include staying mentally active, keeping socially active, eating a healthy diet, exercising regularly, and getting enough sleep. You should also limit your alcohol intake and don't smoke. While there is no guarantee that these measures will keep you from developing dementia, they can certainly reduce your risk. In addition, it's also important to be aware of the early signs of dementia, so that you can seek help and treatment as soon as possible. These early signs can include memory loss, difficulty concentrating, confusion, mood swings, and changes in behavior. If a test comes back negative, you may think that you're safe from cancer when, in fact, you could still have the disease. Despite these drawbacks, cancer screening tests are still recommended for most people over the age of 50. The U.S. Preventive Services Task Force recommends that adults at average risk of cancer begin getting screened for colorectal cancer at age 45. The task force also recommends that adults at average risk of breast cancer begin getting screened with mammograms at age 50. However, some organizations recommend different ages for screening. For example, the American Cancer Society recommends that women at average risk of breast cancer begin getting screened with mammograms at age 40. The decision of when to start getting screened for cancer is a personal one that should be made in consultation with your doctor. Why? Well, that's because the chances of you getting sick increase drastically as you get older. Exercise can help maintain muscle mass and strength, improve balance and coordination, and reduce the risk of falls and fractures. It can also help keep your mind sharp and improve sleep quality. However, as we get older, we may not be able to exercise as much or as vigorously as we did in our younger years. In fact, according to the Centers for Disease Control and Prevention, adults aged 65 and older should aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, plus muscle strengthening activities that work all major muscle groups on 2 or more days a week. Of course, everyone is different, and you should always consult with your doctor before starting any new exercise program. However, in general, the guidelines suggest that most people over the age of 60 should be exercising at least 3 times a week. If you don't take care of yourself now, then you will suffer later on down the road. That means that it's crucial to visit your doctor regularly for checkups. But what exactly should you discuss with your doctor? What are the things that you need to look out for? Well, we've got you covered. In today's video, we'll be discussing 5 questions that you should ask your doctor after the age of 60. Keep watching to find out more. No. 1. Should I be taking a daily aspirin? Many people ask this question, but unfortunately, there is no simple answer to it. Aspirin can help prevent heart attacks and strokes, but it can also cause bleeding in the stomach and other side effects. In general, the benefits of taking an aspirin a day outweigh the risks. However, it really depends on your individual circumstances. If you have a family history of stomach cancer, then you should probably avoid taking aspirin every day. On the other hand, if you don't have any risk factors for stomach cancer and you do have risk factors for heart disease, then your doctor may recommend that you take aspirin every day. The American Heart Association recommends that people between the ages of 45 and 79 who are at high risk for heart disease should consider taking a daily dose of aspirin. However, it's important to note that aspirin can cause serious side effects, especially if you're not careful. So make sure to talk to your doctor first before taking any aspirin. They can help you weigh the risks and benefits and decide whether or not it's right for you. Number 2. When should I start getting screened for cancer? Cancer screening tests, such as colonoscopies and prostate exams, can help detect cancer early when it's most treatable. No. 3. How often should I be exercising? As we get older, it becomes increasingly important to stay active. If you're finding this information useful, please let us know by hitting the like button below the video. Number 4. How can I reduce my risk of dementia? Dementia is a term used to describe a decline in mental ability that is severe enough to interfere with daily life. No. 5. Is it time to talk about advanced care planning? Thank you for watching.